When I'm evaluating patients who have venous insufficiency, I think it's very important to not just think about the veins, because there's a disease state called phlebolymphedema. And as the name suggests, phlebolymphedema is lymphedema caused secondary to venous insufficiency. If you think about it, as the vein starts to become more dilated and blood starts to pool, venous hypertension ensues. And as venous hypertension ensues, the fluid starts to get pushed more out into the interstitial space. Once that fluid is there, it's the lymphatic system's job to try to get that fluid out and to recycle as much proteins as possible. If the lymphatic system starts to get overworked, overloaded, it will start to back up. And unfortunately, at that point, these patients will have chronic swelling. So I often tell my physician peers that if you're going to treat patients as a vascular expert, you have to look at the full picture. And if you're only treating the vein side, then you're only doing half the job because these patients may not get better. And so there's a very, very intimate connection between the venous system and the lymphatic system. If you think about it, with phlebolymphedema, if the vein's causing that lymphedema to occur, you treat the vein and then you also treat the lymphedema at the same time simultaneously. Oftentimes we think that we need to treat one and then treat the other, but no, this should be something going hand in hand because again, one is dependent on the other. Venous insufficiency and lymphedema have a mutual interdependence.